Watch this video till the end before taking amlodipine. You trusted the prescription. You followed your doctor's advice. You took the pill every day, just like they said. But now, your ankles are swelling. Your heart feels like it skips a beat. Your energy is gone. And your doctor? They say, oh, that's just part of aging. But what if it's not? What if the very medication meant to protect your heart is quietly damaging your kidneys, shrinking your gums, affecting your nerves, even setting the stage for a heart attack? This isn't fear-mongering. This is about amlodipine, one of the most prescribed blood pressure drugs in America. And in seniors over 60, the risk-to-benefit equation changes dramatically. Let's talk about the side effects your doctor might not mention, but your body is already trying to warn you about. High blood pressure is deadly. We all agree on that. But when managing it with drugs like amlodipine, seniors face a different set of risks. Why? Because the body processes drugs differently after 60. Your kidneys filter slower. Your liver detoxifies less efficiently. Your muscles and nerves are more sensitive to shifts in calcium, sodium, and blood flow. Amlodipine, a calcium channel blocker, relaxes blood vessels. But that same mechanism affects other muscles, like the ones in your gut, heart, and legs. Ignore the early warnings, and here's what's at risk. Falls and fractures from dizziness and low blood pressure. Chronic fatigue that doctors write off as normal aging. Peripheral edema that mimics heart failure. Kidney stress that can creep toward dialysis. Heart rhythm problems that could escalate without notice. According to the Mayo Clinic, side effects like swelling, dizziness, and heart palpitations are not rare. Up to 1 in 4 patients experience them. But most seniors never know the cause. Why? Because no one told them what to watch for. Until now. Let's start with something you probably didn't know. Amlodipine doesn't work equally for everyone. In fact, studies from the National Institutes of Health, NIH, show that women over 60 are up to 3x more likely to experience side effects like flushing and palpitations than men. And here's the kicker. 80% of these side effects are dose-dependent. That means many can be minimized or avoided just by adjusting the dosage. Yet most seniors are started on the maximum dose, 10 milligrams daily. Even though clinical trials show 5 milligrams is just as effective for many older adults with fewer risks. Ask your doctor why they started you at 10 milligrams. You may be shocked by the answer. Practical tip 1. Beat the swelling without water pills. That puffy ankle you think is aging? It's most likely amlodipine-induced peripheral edema. Here's how it works. Amlodipine relaxes arteries, not veins. So blood goes down to your feet easily. But it doesn't come back up efficiently. Result: fluid leaks into your tissues. And here's the truth. Diuretics won't help. That's right. Water pills don't fix this kind of swelling because it's a fluid redistribution, not retention. What to do instead? Elevate your legs for 15 to 20 minutes twice a day. Wear compression socks. Ask your doctor first. Ask your doctor about switching to a combination drug that includes a venous dilator. Consider lowering the dose to 5 milligrams if possible. In a minute, we'll talk about a rare but dangerous type of swelling that could close your airway. Don't miss that. Practical tip 2. Palpitations and flushing, not just in your head. Feel like your heart is skipping? Feel flushed like you're in a sauna, but the room is cool? That's not your imagination. According to Stanford Medicine, amlodipine can trigger a reflex tachycardia, a sudden increase in heart rate as your body compensates for lower blood pressure. And the flushing? That's blood rushing to your skin as arteries expand. It's common. It's real. And for some seniors, it's terrifying. Here's what helps. Switch your dosing time to evening, when your heart rate is naturally lower. Stay hydrated. Dehydration worsens palpitations. Ask about extended-release versions that reduce fluctuations. But here's the danger. If these palpitations come with chest pain, dizziness, or breathlessness, that's not a side effect. That's a warning sign. Call 911. Practical tip 3. Stop the head spin. Dizziness and lightheadedness affect up to 24% of seniors on amlodipine in the first month. The most dangerous version? Orthostatic hypotension, a sudden drop in blood pressure when you stand. This is how most seniors fall in the bathroom. Here's how to outsmart it. Sit up slowly. Before standing, dangle your legs off the bed for 30 seconds. Drink a glass of water before getting out of bed. Ask your doctor to check your morning blood pressure. That's when dips are most dangerous. Later, we'll we'll talk about a side effect that can mimic Alzheimer's. And yes, it's linked to amlodipine too. Most people think blood pressure drugs are all the same, but that's dangerously wrong. Here's what the Cochrane Review, 2020, found after comparing over 100,000 patients. Amlodipine is more likely than other drugs to cause ankle swelling, flushing, and dizziness, especially in seniors. Yet it's still the first drug most doctors reach for. Why? It's cheap. It's easy to prescribe. It's effective at lowering BP fast. But here's the part they forget. Lowering your BP by 20 points doesn't matter. If you can't walk, can't sleep, and feel miserable, quality of life matters. And if your body says no, listen. One of the most common and easily overlooked mistakes seniors make with amlodipine is taking it on an empty stomach first thing in the morning. While the label may not explicitly warn against this, it's a critical detail that can significantly influence how your body tolerates the medication, especially if you're over 60. When taken without food, amlodipine can cause a rapid onset of side effects like dizziness, nausea, headaches, and lightheadedness, particularly noticeable when you move from sitting to standing. This happens because amlodipine lowers your blood pressure by relaxing your arteries. If your body hasn't yet stabilized after sleep and your stomach is empty, this sudden drop in blood pressure can hit harder than intended. For older adults, whose blood pressure regulation may already be impaired due to age-related changes or multiple medications, the effect can be much more pronounced. The result? Increased risk of falls, imbalance, and feeling faint, some of the leading causes of ER visits among seniors. Moreover, many seniors take other cardiovascular drugs like beta blockers, diuretics, or statins in the morning. When amlodipine is combined with these medications on an empty stomach, it may intensify the drop in blood pressure or cause unwanted interactions, further stressing the system. The solution is surprisingly simple, yet extremely effective. Always take amlodipine with a balanced breakfast. Not only does food help slow the absorption of the drug for a gentler effect, but eating also raises your blood pressure slightly, which counterbalances the medication's initial impact. Also, drink a full glass of water to help with circulation and ensure the medication is properly absorbed. And make sure you remain upright, sitting or standing, for at least 15 minutes after taking it. This allows your body to stabilize and reduces the risk of sudden postural hypotension. In short, this one minor adjustment, taking amlodipine with food, can help prevent 3 or 4 of its most uncomfortable and risky side effects. It's a small habit change with major safety benefits. Now let's move fast, but don't overlook these. 1. Constipation. Amlodipine slows smooth muscle contraction in your intestines. That means slower digestion and harder stools. Fix it. Hydrate. Add prunes or magnesium citrate with doctor's approval. Increase fiber intake gradually. 2. Muscle tremors or stiffness. Rare, but linked to calcium signaling interference in muscles. Reported in NIH adverse event data. Report any new tremors to your doctor immediately. 3. Gum overgrowth, gingival hyperplasia. This bizarre side effect causes gums to grow over teeth. Seen most often in men. What helps? Meticulous brushing plus routine dental cleanings. Switching to another medication may be necessary. 4. Taste changes. Some seniors report metallic or bitter taste. This affects appetite and weight, especially dangerous for those already frail. If it doesn't resolve, report it. 5. Angioedema. Unlike normal swelling, this is sudden, deep swelling of the face, lips, throat. Can close your airway. It's a medical emergency. Call 911 immediately. 6. Liver stress, hepatotoxicity. Extremely rare. But signs include yellowing eyes, dark urine, or upper right abdominal pain. Blood tests, AST/ALT, can confirm liver involvement. 7. Heart attacks, in certain cases. Paradoxically, in people with severe coronary artery disease, amlodipine can trigger angina or even a heart attack. New chest pain after starting it? Don't wait. Get checked. 8. Peripheral neuropathy. Burning, numbness, or tingling in hands or feet. Rare, but documented. Vitamin B6, B12, and magnesium may help, but stopping the drug may be required. Some sexual side effects. For men, erectile dysfunction is not just emotional, it's biological. Though amlodipine is not the worst offender, it still impacts. blood flow to the pelvic region, muscle relaxation, energy and confidence. High blood pressure itself also causes ED. So don't blame the med without full testing. Speak to your doctor openly. You are not alone. Final recap, and what to do now? Let's bring this home. Here's your checklist if you or someone you love is on amlodipine. If you or someone you care about is taking amlodipine, it's crucial to stay proactive rather than passive. Start by monitoring your blood pressure consistently, especially in the morning and after any dose changes, to catch early signs of it dropping too low or spiking too high. Always take amlodipine with food, not on an empty stomach, to reduce the risk of dizziness, headaches, and nausea. Never stop this medication abruptly. Doing so can cause a dangerous rebound in blood pressure, which could trigger a heart attack or stroke. If you notice swelling in the ankles, persistent fatigue, a racing heartbeat, or dizziness when standing, report these symptoms immediately. They could be your body's warning signs. Ask your doctor whether you truly need the full 10 milligrams dose. Many seniors maintain stable pressure on just 5 milligrams with fewer side effects. Some may benefit from switching to combination medications that better balance arterial and venous tone. Lastly, be vigilant about serious red flags: sudden facial swelling, chest pain, numbness in your hands or feet, strange taste disturbances, or signs of liver stress like yellowing eyes or dark urine. These may signal a serious reaction. Remember, when it comes to blood pressure meds, silence isn't golden. Speak up and stay safe. And most importantly, don't accept "you're just getting older" as a diagnosis. It might be your medication.